Hello, welcome to today's episode of Cancer Awareness. I'll be telling us today about breast cancer. Before I proceed, I would like to tell us a short story about a survivor of breast cancer. Sarah was a mother of two young children, full of life. She was working as a banker. On a fateful morning when she was having a shower, she noticed a left breast lump. Life happened to her. She had mammogram done, then followed by biopsy, which confirmed to be a stage 2 breast cancer. That happened to be the most fearful event in her life. Following this diagnosis, Sarah had treatment. She had surgery followed by chemotherapy, and she also had radiotherapy, after which she entered remission. As we speak, Sarah is currently cancer free. Now, Sarah is one of the survivors of breast cancer. So, I'll be talking to us today about breast cancer. Follow me, watch out as I speak about the symptoms, the risk factors, how to prevent it, and the myth and facts about breast cancer. Facts about breast cancer. There are quite numerous facts to know about breast cancer. One of which is it happens to both gender, to both male and female. And also, breast cancer is the most common cause of cancer globally in women, and also the most common cause of cancer-related deaths in women. Also, most breast cancer do not present with lumps, and regular screening is the key. So what are the myths about breast cancer? People have believed that breast cancer only happens in women. However, it has also been recorded in men, although it is very rare. Another myth that people believe about breast cancer is that using deodorants or antiperspirants increases the chances of having breast cancer. This is not true, as there are no evidences in any study. People believe that wearing tight bras increases their chances of having breast cancer. This is not true as well. Now let's talk about the symptoms of breast cancer. What are the things that people notice in their breast that make us suggest it is breast cancer? The first and foremost is change in the size of the breast and also change in the shape. It is quite natural that the left breast is bigger than the right. However, if there are noticeable changes in the size and shape of the breast, it suggests breast cancer. Having nipple discharge, usually if it is bloody, and also having an inverted nipple or nipple crusting, change in skin around the area of the breast, usually like the texture of an orange peel, feeling a lump in the breast or the breast appearing like there's a bump. Having a lump in the armpits could also suggest breast cancer. Breast pain or nipple pain would also suggest breast cancer. So putting all this together with other systemic symptoms like weight loss, loss of appetite, dizziness can make us to highly suggest that this is breast cancer. What are the things that put us at risk of having breast cancer? They can be divided into two. There are modifiable ones. Those are things that we can easily control, and the non-modifiable ones. Those are the things that are beyond our control. So I'll be speaking about the non-modifiable ones first. First of it is age. Above the age of 50 puts people at risk of having breast cancer. Then gender. It is quite common in female than male. Genetic. Some people have been shown to have mutations or changes in their genes that put them at risk of having breast cancer. The fourth one is family history, usually in the first degree, which includes your mother, the father, or the siblings. Any one of them that have breast cancer also puts you at risk of having breast cancer. People that have had breast cancer treated in the past are also at risk of having a recurrent breast cancer. Another one is having a dense breast tissue, usually in people that have increased body fats. Having exposure to radiation. This is usually common in people that have treatments in the past that has to do with being exposed to radiation, either by imaging, like a CT scan, or by radiotherapy. Now, talking about the modifiable risk factors, these are risk factors that are within our control. There's a major hormone in our body which we call estrogen. When the body of a female is exposed to too much of estrogen, it's put them at risk of having breast cancer. So one of the things that increase our exposure to estrogen is early menstruation. People that started their menstruation very early in life are at risk of having breast cancer. And also people that have late menopause, that they saw their menopause at a very later year in life, are also at risk of having breast cancer. Also obesity, also smoking and alcohol. Women of breastfeeding age that do not breastfeed, they have increased risk of having breast cancer. Having a child after the age of 30 years also puts people at risk of having breast cancer. Another important thing that has also been shown to put people at risk of having breast cancer is use of oral contraceptives. The ways to prevent breast cancer, like quite a lot of them. But two major things that should be at the back of our mind is good lifestyle habits and regular screening. These two things will help us prevent the risk of being exposed to breast cancer. you need to avoid smoking or limit alcohol intake. Women of breastfeeding age group should try as much as possible to breastfeed their babies. Do not say you want to keep your breast in shape and trying not to breastfeed your baby. Doing that also helps you to reduce your chances of having breast cancer. Be physically active when it comes to preventing breast cancer or any form of cancer. You can dedicate 30 minutes every day for exercise, and it's also a good weight. And lastly, is to ensure that you take adequate balanced diets. Balanced diets, I mean, is food that are rich in fruits and vegetables, especially the green leafy vegetables. About screening for breast cancer, we talk about mammogram. Mammogram is a special kind of X-ray that helps to detect early changes in the breast. It is usually done routinely from the age of 40 to 74 years, every 1 to 2 years. However, in people that are high risk, especially people with family history of breast cancer, it is encouraged to be done earlier than that. It helps to detect breast lump and also some calcifications. So it is encouraged to do a breast self-examination. Whenever you feel a breast lump at any point in time, it is encouraged to come to the hospital as soon as possible in order to get checked. This breast lump might be taken out, either parts or completely, to test it under the microscope to know the nature of the cells. Thank you for listening to this episode of Cancer Awareness about breast cancer. I will look forward to your comments in the comment section. Kindly like, share with your loved ones, and show them how important it is to prevent something as deadly as breast cancer.